Joining me now is Alex van der Heever. He's an independent health and social security economist. I'm also joined by COSATU spokesperson Patrick Craven. We know that the strike has been ongoing for around 16 days, and as we mentioned, the revised offer by government of a 7.5% wage increase and of course an 800 Rand housing subsidy has been rejected by the unions and its members. Gentlemen, thank you very much for your time. Patrick, let's start off with you. Any news? We know that the unions are currently meeting with government. Have you heard any news thus far?
Not at all. The unions are meeting amongst themselves at this stage. We haven't even got as far as a meeting with the government. But it's likely, of course, that there will be a meeting with the government after the unions have digested all the feedback they've been getting from their members, which, as your report shows, is clearly for rejecting the latest offer, and will then decide on the way forward over the next few days.
So Patrick, members are sticking by the 8.6% and 1,000 Rand housing allowance. This is despite the fact of news reports that we know the government cannot afford this wage increase.
Well, that is of course debatable. One of the problems with this whole dispute is that the government has said, I think on 5 times, that this is their final offer because they have no more money. And yet mysteriously more money keeps arriving from one source or another. And I think the workers are becoming very cynical. Governments around the world always have ways of raising money. It's not like a finite sum of money. They can borrow money, they can issue bonds, they can raise taxes.
But don't you think government is in a difficult position? This is why they keep revising their offer, because they need these essential services to start once again.
Absolutely, and they are at some point going to have to find some more money. But in our view, this is not necessarily a bad thing, because this has never been simply a dispute about individual people wanting more money. It's about part of a process of reforming our overall public services to provide the kind of quality service which is so terribly lacking at the moment. And one of the reasons for that is pay has been so low that staff are demotivated, working in very, very difficult conditions, and have not been providing the kind of service which we all want.
Alex, do you think that a wage increase is the solution to unproductive workers and the fact that we do not have efficiency in our public system?
Well, that is, it's very questionable that is the cause of our inefficiency, the sort of low pay. I don't think that the South African public service is necessarily paying less than what you'd find in many other developing countries equivalent to South Africa. The low and poor performance in South Africa is exceptional. We're one of the worst performers for the amount of government expenditure we've got. Our maternal mortality rates are about 5 times the sort of average for the whole of Latin America, with the best performing Latin American countries with the same per capita GDP as South Africa, with under single-digit figures for maternal mortality rates. It's about 9 to 10 versus our sort of 400 to 650, depending on which survey you look at. That's an extraordinary indication of poor quality of care. That has absolutely nothing to do with wage rates. It's got a lot to do with the accountability structures, with the performance framework that we've got in place, and the organisational designs that we have in place. And these wage increases do not respond to that.
Do you think they're warranted at this point?
I think the technical arguments for the kinds of increase that's being looked for at this point of time are very, very weak. I think that you're not going to solve many of these fundamental problems with what are essentially about 3 to 4% real increases in wages across the board.
Let's take a step back. Occupational dispensation, which was changed for nurses in 2007, it cost the state around 8 billion Rand in 2008. We saw structural changes for nurses when it comes to wages. What do you think that was warranted, and do you think that that should have been enough to cover various expenses for these public servants?
Well, what you had with that particular increase was a very substantial one-off structural change in the sort of remuneration of nursing staff. It was meant to be only for specialised nursing, but ultimately ended up being far more generalised. The additional 8 billion Rand was the unfunded portion of the occupational specific dispensation. So one of the predicaments that government's in now is that in effect it has a massive deficit that's embedded in the public health system of possibly at this point in time of between sort of 10 to 12 billion rand, which basically has to be refinanced before you start looking at these additional costs.
We've also heard media reports, Patrick, that there have been a few deaths because of the strike, because people weren't able to get medical assistance. What is your response to that?
Obviously, we deeply regret any deaths in hospitals, but we cannot accept that they can all be blamed on the strike. There was a big public scandal before the strike began about particularly babies dying in hospital, and yet suddenly once the strike began, these are all being reported as being a result of the strike.
Doesn't that come down to efficiency as well?
Exactly. It comes back to the heart of the problem, that we have an absolutely deplorable level of service. And I think Alex agrees with me on that. And of course, I'm not saying that you'll solve all that simply by paying staff more. We need to find far more money and far more efficient ways of running our public services, with the aim ultimately of having a service which is so good that we no longer need a private sector, because you will get good service.
And you're to the National Health Insurance Scheme.
Absolutely. This is absolutely key to solving our problems, I think.
Do you think the National Health Insurance Scheme stands right now? Because it seems that we've got a little bit of a taste of it now during the strikes, because we've seen what's been happening in the private hospitals, and we've seen an influx of patients. Alex?
Yeah, I mean, I don't, one would have to talk about what one means by national health insurance. I think that the key issue is that the base system upon which we sort of guarantee universal access will always be based on a version or variant of our current public system. What we can't afford to have, which is very important, is we've got to have a way of dealing with annual wage negotiations which are purely dealing with increases, generalized increases, which do not result in these unproductive and destructive strikes each year. So there is a very big question about resolving this particular issue. Other issues dealing with the efficiency of the workforce need to be dealt with through other interventions which are deeper and look at the structure of the remuneration, performance-related rewards and organizational.
So you're saying productivity first, wage increases later?
I'm saying that wage increases need to happen regularly. What we can't afford to have is a one-month strike every year affecting schools and healthcare just to solve how much we're going to increase general wages.
Do you think what the members are saying at this point, where let's come to an agreement for the next 3 years, we'll get a specific wage increase? Do you think that will help stabilize the system?
Well, it depends what ends up in that increase. I think that that's not the only issue that resolves it. I think that the way in which disputes are resolved is important. The current design is highly inefficient. So really what it amounts to is sort of different forms of brinkmanship and sort of destructive conflict, which are used to gain advantage in a wage negotiation. The issue is really how you end up with some form of rational arbitration of the different bids that are being put on the table. And we don't have that structure in place. We've got a very inefficient design for resolving these annual disputes. That needs to be resolved. It needs to be resolved across the board where we're dealing with these general wage negotiations. And that's a distinct issue because it doesn't deal with productivity and the rest. How you resolve the other issues are different processes. This is a process for annual increases. The processes to deal with real efficiency gains are elsewhere. We will not get any efficiency gain from an annual wage negotiation.
Patrick, looking at the fact that many AIDS patients aren't able to receive ARVs, I mentioned various deaths happening, or these are just reports of various deaths happening at some of the hospitals. People weren't able to get any assistance, medical assistance. We have schools closing down as well with regards to this strike. Just prior to the World Cup, we saw a massive strike that, of course, affected Eskom. Many say that the union should be answering from an ethical perspective as to why the wage negotiations are becoming even more aggressive in the country. Is there a specific reason why this is happening? Because you definitely get a sense of things becoming more difficult in 2010 as what they were in 2009 and prior to that as well.
I don't think there's anything particular about 2010, but what we are seeing is the inevitable results of what our General Secretary has frequently referred to as a ticking time bomb. And he's referring to the huge levels of inequality and poverty in our society, which are reflected in many ways, and this is one of them. The reason why so many of these strikes seem to be so bitter is that people see their employers, both in government and in the private sector, earning sometimes hundreds, even thousands times as much as they are earning, which has turned South Africa into the most unequal society in the world. And so it's inevitable that there will be disputes like this. And that's why we need to address the thing more broadly, and I think this is where we might agree. There has to be a clear policy, and COSATU will be calling in the near future a living wage conference, which will try to address this policy in a more general way. How do we deal with these levels of inequality? What should people be earning? What should be the minimum? What sort of differentials should there be? Because at the moment, it's simply left to market forces, even in the public sector. And that clearly is bound to lead to these confrontations and these bitter disputes.
Alex, I can see you want to say something.
Yeah, I mean, I think that there are general policy problems that South Africa has to resolve, which cannot be resolved through these annual wage negotiations, and I don't think that they can be used as a rationale. I think we have to separate what the problems are. South Africa's high levels of inequality are to a large extent a consequence of the low levels of employment that exist. The people who are employed are in a very privileged position. Many of the people on strike today are considerably more privileged than the vast majority of the population, whose problems are not being resolved from a policy perspective and won't be resolved by these current wage negotiations. They are different policy issues. Ultimately, we do have to be very careful about what happens, and I want to raise the point on government finances. Government doesn't have an unending, it doesn't have an open checkbook that it can draw on. If it's going to borrow more, what I expect they're thinking of during this process is that they can basically go into the deficit. They can deepen the deficit for this period. That creates a long-term problem about debt refinancing over a period. They're going to balance that against what they do. If they want to keep the overall expenditure levels constant, they're going to focus on reducing staff levels going forward by holding government departments to their budget limits. And that will be the consequence of high unit cost changes in the public system.
Patrick, what's your response to that? 25%, over 25% unemployment. Some say it's even higher than that. And then we have wage negotiations, almost double that of inflation. Again, I ask you if it's warranted.
Obviously, unemployment is our biggest single problem, but we categorically dispute the argument that you can somehow solve the problem of unemployment by reducing the living standards of the people who are employed. That will make the problem even worse. It will just spread the poverty even more widely, reduce demand in the economy, and send us in a downward spiral, which ultimately will be disastrous.
Alex, how are we going to pay for this? We've got a debt to GDP ratio of around 28%. It's not that bad in comparison to most of the developed world. We've got a budget deficit of around 6.7%. One of the solutions are, of course, that we spend less elsewhere to try and fund the wage increases.
Well, I expect that if government pays a much higher increase, it's going to focus on staff reductions as a strategy going forward. So it's going to hold government departments to their overall budget levels and rely on staff attrition to bring down the numbers. That if they want to keep the and maintaining the deficit at a reasonable level and the overall level of debt at a reasonable level through time, which is an important objective to have, otherwise you crowd out your government expenditure just refinancing your debt. Then what we will see is the quid pro quo for the higher real wage increases in this will be reduced staff numbers, which will increase unemployment levels potentially if the private sector is not absorbing those people.
Patrick, last word on that, because that's quite a dire situation. It'll decrease the employment levels of government. That is a scary scenario that the unions are going to have to grapple with.
But it's not new, because the government has in effect already been implementing that policy by not filling vacancies. And that is absolutely not the solution to the problem at all.
There's been, since 2007-8, the public sector health workforce has increased by 20,000 in terms of straight headcount. So that's a massive increase over the past few years, even after the occupational specific dispensation increases were given to nurses. So what we will probably potentially now see is a reversal of that increasing trend. They haven't been cutting staff, they've been increasing.
We shall still continue to fight for every job, because we need more people working in our public services, not fewer.